One of Singapore's largest HIV test providers is rolling out more frequent mobile services to boost early detection of the virus. The added convenience has seen more sign-ups. Now it's part of efforts to stem cases of late-stage HIV that could progress to AIDS. Some clinics are already seeing around 60% more HIV tests done yearly. Sherlyn Seah has more.
It looks almost like any other van parked in a housing estate. But inside, dozens of HIV tests can be done each day. People can just walk in for an anonymous test.
With the van, we are able to deploy at various locations around Singapore and at timings that are more convenient and accessible to those people who are working. Sometimes on weekends, we also deploy near bars and clubs.
Sometimes it also goes to office areas. Demand has been trending up. So the plan now is for the van to make more rounds each month at new places. Currently, the NGO conducts nearly 6,000 such tests each year in this four-wheeler and at its physical clinic. The aim is to get at-risk groups to test more frequently for earlier detection.
Of the newly notified cases annually, more than 50% of those are at late-stage diagnosis, and of which only 15% receive their diagnosis through self-initiated HIV testing. So we need these two areas to improve. We recommend that for sexually active adults to test at least once a year.
If they find out early, people with HIV can take medication to prevent them from developing full-blown AIDS.
Treating somebody who lives with HIV has been shown to reduce the rates of transmission greatly as well. So the message of undetectable, meaning untransmissible, there's quite a lot of undeniable evidence now that that's the case. So treating patients who are diagnosed is very important.
DTAP is another one of 10 anonymous HIV test providers in Singapore. It also has 6 physical clinics. Last year, it did 2,000 tests, or 60% more than the previous year. To make it more convenient, the healthcare firm has rolled out a concept that's been gaining traction.
At this express clinic, the tests are done in these individual stations for privacy. There's also no doctor on site, and the results are emailed to each patient just 20 minutes after the test. And in the event results are positive, they will get referred to another clinic branch for treatment.
The firm believes new HIV cases went up in the first 10 months of last year because these were picked up with more tests. Still, the number of people getting diagnosed has been going down over the past decade, a trend that health groups like DTAP say is because of awareness of safe practices and frequent screening.